Dr. Ajaikumar, Chairman and CEO, HCG Group of Hospitals, headquartered in Bangalore, India. India is being a vast country of 1.2 billion population. We know cancer incidence is increasing because of the aging, change in the lifestyle. So compared to 2 decades and now, even though the infrastructure has improved, private enterprise has played a major role in changing the face of cancer care in this country. Still, various challenges exist. Particularly, you have India where there is 200 to 300 million who are coming up the ladder, middle and upper class, who are demanding highest care possible. Then you have nearly 900 to 1 billion population with a lower socioeconomic group, for which we also have to meet the needs for their cancer care. That is a challenge. How to bridge this gap is the greatest challenge for us. But India has now mastered the high quality of care in cancer care. Compared to the past, we can proudly say our outcomes in cancer care are equal to the best of centers in the world. And going forward, how to make this happen to the entire population is what we have to work on. Various models have been established by the government and also the private enterprise. With these models, we hope in the next decade or so, we will certainly overcome this challenge. Today, a lot of multi-speciality hospitals do provide cancer care. But with the genesis of how HCG has started, one of the few private dedicated oncology center is an example where we have changed the paradigm shift in oncology care using hub and spoke model. We do believe a dedicated focused factory approach in cancer care is very important to get good outcomes. And particularly the need is not only in tier 1 cities, but also in tier 2 and tier 3 cities. Using the hub and spoke model, it can effectively be addressed. So patient who is in tier 3 city also can have access to same technology and same kind of quality of care. So in the long run, they can also get the same kind of outcome. Opportunities exist, high technology is coming in, and today with information technology and developments happening in genomics, we do believe going forward cancer care will be uniform across the country, and it is achievable particularly in a country like India. The most important thing in cancer care has been why some patients respond and why some do not. And this has been studied for decades. Now, with the technology being available and the cost also having come down, we are beginning to collect data. Going forward, data will be the most important thing. Example, if I treat 100 patients, only 50 of them respond and 50 do not respond. Obviously, the 50 are getting wrong treatment. So, by collecting the data, and in future, when I see a patient, does this patient belong to category A, B, C or D? And I pull the data based on it, I treat patients first time itself the right way, whether it's A, B or C, D, that will give us the better outcome and the failure rate will be less. So that is the reason why data becomes very important. Also in the era of genomics and era of drug discovery, data is going to make a huge difference in new drug discovery. The other important thing is, in the past, all of us have used protocols based on Caucasian trials. As we collect more data about Indian population, Asians, we are beginning to understand there are different genomics in this kind of population. Thereby, they may require actually different treatment or less dosing. So this is again a game changer going forward. We are on the verge of this. We have nearly done in HCG group 5,000 genomic data, finding out 38% of the time there is a change in the genomics in the Indian population, which is going to make a difference in the actual treatment and outcome. So genomic data is going to play a huge role. Similarly, AI, as we go forward, as we look at, for example, imaging or pathology, using artificial intelligence, we can actually decide what should be the pathology, real pathology. Using algorithms, we can say whether the patient has certain mutations, whether the patient has certain tumors which are more aggressive than others. So we have actually studied hundreds and thousands of, for example, PET scan. Using that, we are able to understand the radionomics of the patients, thereby deciding who has got aggressive disease and who does not have. So in future, this will bring definitely uniformity of care for our cancer patients, and human interference will be less and less required. As we know, in the past, a lot of affluent people went to other countries, developed countries. Still, there are a number of people who go because the change is happening. But the positive thing is people are beginning to recognize that there is high quality of care in India itself. For us, very recently, HCG has been studied by Harvard Business School, which showed our outcome is equal to the best of centers in the world. More recently, World Bank has studied our model independently, where they showed our quality of care is better than NHS of England, and our outcome of breast cancer is equal to or better than what is being published by American Cancer Society. So what it shows is tremendous improvement has happened in quality of care. It is beginning to impact on the population, and in future we do expect majority of the patients to stay in India. One good thing is we are getting a lot of international patients now, which was not happening in the past. For us in HCG, we get a lot of patients from Africa, Middle East, and even from countries like South Africa, clearly saying that what people who are migrating or going to Europe or US from other countries, other emerging markets, are beginning to come to India because of what we call the value-based medicine. Value-based medicine is clearly, if you spend, for example, $20,000 to take a treatment in Europe or US, you may be spending actually $5,000 to take a treatment in India and get the same outcome. That is what is attracting a lot of patients to come here and get that kind of quality and value-based care in India, and we are very proud of it. Ayushman Bharat was started as a care for lower socioeconomic group. Even before Ayushman Bharat came, lot of states had schemes for lower socioeconomic group. But the issue with Ayushman Bharat, while the idea conceived is good, it is actually causing lot of issues in the quality of care and outcome because of the reimbursements rate, time of reimbursement, and people who are eligible. What we have suggested is to really bring about uniform, what we call as universal health care. This is the only answer for India. Rich or poor should get the same kind of care. Today what is happening is rich are getting better quality of care compared to lower socioeconomic group, and Ayushman Bharat is certainly not helping that. So we need to really change it to bring about uniform healthcare across, what we name it as universal healthcare. Simple measures like doing a education cess. For example, everybody uses a cell phone. Can we tag in a health cess to this, whereby that pool can be used to bring about what we call as universal healthcare? Naturally, India has a lot of youths. We expect youths to not get sick, so they can contribute towards it, this insurance, and when they become old, they can get the benefit of getting free health care. This is a system which has worked very well in several countries. Even an emerging market like Brazil has this system. So why not in India? We have proposed this, and certainly the amount we spend for healthcare is abysmal. We spend only $83, and compared to Europe spending $5,000, United States $9,400, and even China spending over $500. We need to move up this amount we spend and bring uniform healthcare so that, as I said before, rich and poor doesn't matter. They should get same treatment, and then the outcome will be similar. We hope we can achieve this in near future. I think in HCG group of hospital, our focus being more on high quality of care and good outcome, we have now incorporated a very good electronic medical record system, whereby across India we are able to capture the data of each patient, what is the stage with which we come, how they are treated, and what is the outcome. Apart from that, with technological advances, we have most recently, of course, introduced CyberKnife even in Mumbai now. First time in Maharashtra, we have brought CyberKnife, and in a very prestigious place in South Mumbai, we have installed it. We are also using a technology called Radisac, so the patient's treatment can be delivered very fast. And last few weeks back, we have installed in Bangalore the digital PET CT scan, one of the few in India. What the digital PET CT does is it not only gives you better delineation of the tumor, even at millimeter level, but also as a treating doctor, we can freeze the tumor and really give precision treatment. This, along with the advances in treatment in terms of what we call as immunotherapy, radiation immunotherapy, chemotherapy with immunotherapy, have made tremendous strides in cancer treatment. What we thought was unresectable, today we are making it resectable. What we thought even few years ago was untreatable disease, today we are making it treatable. So there has been a big change in the way we approach cancer care, and we have taken a leadership role in this. Our vision is very simple. Certain number of cancers you can cure, of course, depending on the stage. If you cannot cure, still you can convert cancer to chronic disease like diabetes or other lifestyle disease, whereby patients can live a long, normal life for a long time, even with advanced disease. So today when patients come and say, I have stage 3, 4, first thing we tell them is, it is not the stage. Let us treat the disease properly, make it into chronic disease so you can have a long life. That has been a major change in HCG, and we're looking forward. We think this will continue, and challenges are there, but we are well prepared to take these challenges.